and welcome back to another episode of The Architecture of Health, the show where we explore practical and unexpected ways to create environments for health. And my guest this week is Shaun Astorga, who has a doctorate in clinical physical therapy and who helps PTs, coaches, and patients solve movement problems and get back to doing what they love. Thanks for coming, Shaun. It's a pleasure to have you.
Deb, thank you for having me. I'm excited to be here.
The reason I invited Shaun is I participated in a remote mentorship program with him to really understand breathing mechanics and repatterning movement. And what especially attracted me to Shaun is he had this transformation from being a finance person to getting fully immersed in cutting edge physical therapy. So can you tell me a little bit about what got you moving in this new direction?
So a lot of the things that I've done from a professional standpoint really came from injuries that I experienced and my experience in the medical system as a patient. So like you had mentioned, I started my career, I was in the finance world. And during that time, I was always spending a lot of time like studying fitness related things. I played sports like football, basketball in high school and college. It was a big part of my life. And as a result, I was always kind of in and out of like the trainer's office, athletic trainer, just because of you get banged up playing sports, right? So little injuries here and there. And then I worked in the finance world. I hurt my knee playing basketball. And that was my first real exposure to physical therapy. And I just kind of went like any normal person would go. And I kind of did everything I was supposed to be doing, and I didn't really get better. So I started kind of questioning in my head the process that I was going through. They weren't really ever assessing anything. I never really knew if I was doing like should I be feeling better by now. And it really ultimately led me to thinking that there's got to be something different out here. So I literally just like looked up sports physical therapy, and I found one by my house. Her name was Janice Mora, and I went there, and it was very different than my first experience at PT. I was like doing stuff like she looked at how I moved, she assessed me, we did things, and then she would reassess me. So I could kind of tell we were doing things that were very, very proactive for the situation. And ultimately, like, it was a very active approach to physical therapy. So this was something very new for me. And that kind of sparked my interest to go back to school and become a physical therapist. So ultimately, my wife, well, now she's my wife. She was like, basically, you're not getting any younger. If you're gonna make this switch, like, let's make this switch, so that you can, not be like 70 years old when you graduate and start practicing. So I made the switch. She went to PT school. And I graduated. Then I suffered a concussion and a brain injury and a neck injury, and it took me out of work for about a year. And during that process, I was exposed to the medical system once again. And I got very, very frustrated with my experience because I was getting sent from any specialist you could think of. No one could figure out why I was not getting better, why I was not recovering. And every person operated in a silo. So if I went to a neurologist, they looked at everything from a neurology perspective. If I went to a balance person, they looked at everything as a balance person or a balance issue. I went to a speech therapist. It's all like speech related. And it was very, very frustrating for me as a patient and a medical professional because I just had no clarity on the situation. No one could provide me answers. Everyone just kept saying, no, it's not this. It's not this. Everything seems fine. And I'm clearly nothing, was really fine. And it was through that process ultimately that I worked with one of my mentors, Bill Hartman, and a couple of other people from his circle. They helped me get back to where I'm at now. When I injured my head, I was told a lot of things, like I was not going to be a physical therapist again. I'm not going to run again. Running is very important to me. It's the sport that I kind of gravitate toward. And I wasn't going to be able to do a lot of the things that I wanted to do. And then they showed me that I would be able to do that. So that was the impetus to start my practice, ultimately.
Okay, this is lovely. And I have had very similar experiences, which is what got me here. One including a $350,000 bill and no cure. And yet a shift in eating changed everything. So one thing I heard is that you worked with Bill Hartman, mm-hmm. and that another thing I heard was not accepting that you wouldn't be able to return to doing the things you love to do. Like he helped you know and believe that you could restore yourself to being able to move and be the way you wanted. One thing after working with you, I have listened to more of Bill Hartman's work on YouTube, and I was fascinated when he described how before we had all these heavy hitting, overbuilt almost emergency medicine systems that, like you said, get these deep silos that are not so integrated and they make a lot of money. Before that, I remember him talking about doctors used body shape and breath as one of their main ways of evaluating what they could do to help a patient. So are there any specifics in working with Bill that were unexpected that you could share with the audience?
I worked with him. Honestly, it was only one session from like he treated me standpoint, and then I went through his mentorship, and he gave the tools right for me to kind of figure things out and find the right people to help the situation out. But if I had to say, that would be the one thing is he taught me the importance of having foundational like first principles to guide my decision making as a professional, right? And you can apply that same rule to how you run your life, right? That was the biggest thing for me. A lot of patients that we work with come to us because they've quote unquote failed physical therapy, or I've already tried physical therapy, it didn't help. I've gone to a chiropractor, it didn't help. And a lot of times they have the perception that they're a unicorn, right? That there's something like mystical that needs to happen for them. But the reality is something probably very basic was missed. Something foundational was missed by a lot of medical practitioners, and they unfortunately got sent on this path where they're searching for something that, I don't know, it can get pretty weird in the medical world. When reality is they are missing, like in my case, I didn't have enough joint range of motion to do the things I wanted to do, right? Or it could be something else, right? Like you just said, a dietary change, like was literally everything that you needed. So it's really being able to find those types of things. And that's something that he's helped me with as a practitioner is really being able to understand the person as a whole, their entire situation, and figure out what is actually missing. What's the thing that we can put back into the situation that's going to have the biggest positive outcome. And then of course, measuring that.
Yeah. So that was my next question was, what are the patterns you've seen with people that you help over and over? And it sounds like one is they have this idea that it's this mysterious, super specific, strange thing going on when there are known patterns and there are known foundational principles that help people feel better. And one thing that I get when people come to me as a movement specialist is they want to have their MRIs and their X-ray, and they're like, oh, well, I have a short leg, and then I say back, well, you've got this asymmetric spiral in your body that's expected as an aging sedentary human, and everybody thinks that they have something really unique going on when in many cases it's not. Is there anything you want to say about the types of basic foundational principles that are overlooked or missing?
Yeah, well, the first thing I do want to say though is it's not anyone's fault, right? That's just kind of how the medical system tends to make people feel. And I don't want to sound like I'm bashing the medical system. Like there are a lot of great practitioners out there, and like every doctor serves their purpose, right? But a lot of times it's exactly what you just described. Like a person has an MRI, and right, it shows something that sounds very scary. But we also know that a lot of these findings on MRIs are incidental findings. It's just they happen to look at a person's shoulder with an imaging because they have shoulder pain and no one's figuring it out, right? And they never look at the other shoulder. I would guarantee that in a lot of people, the MRIs are going to look similar. Why do they only have pain in one side versus the other? It would become my question. From a foundational principle standpoint, in my realm, a lot of injuries come down to a person's doing too much too soon, meaning they jump into something too quickly and it's just too much for their body to handle and recover from, or they've been doing too little for too long. And right, let's take a sedentary person, right, and then they just jump into an exercise routine and then something starts hurting, right? It's not that the exercise routine was bad, it was just maybe too much for them at the time, right? So then it's like you can kind of tease that out of the situation. But that is a very realistic scenario for a person, and it could spiral out of control very quickly if they go to a doctor who maybe is not familiar with exercise or doesn't ask the right questions, or maybe they only spend 5 minutes in the room with the person and they tell them, right, we're going to get some imaging on this, and then the imaging shows something, and then out of control, right? They get sent to all these different places. So that's a very realistic scenario. So from like a guiding principle standpoint, for me, it's always comes down to understanding the person's story, and then being able to use our assessment process, which is like very holistic, looking at the whole body, to kind of connect the dots for them and understand, why they are feeling the way that they might be feeling, and what levers can we pull to know we're going in the right direction.
I know some of the work I've learned from you looks pretty gentle. Do you find resistance to this approach?
I would say not from clients, like patients who work with us, because they're coming to us for a specific reason. Ironically enough, the resistance comes from other practitioners who have an outside perspective that they're not comfortable with it being challenged. It tends to be how that process goes. Yeah.
Well, how would you say your approach is different? You suggested that you do a holistic assessment rather than a spot reductionist view at the stressed tissue. You take measurements, and then you keep feeding change and retesting to make sure it works. Is that very different than what other people in either physical therapy or personal training, or when you say there are these other people that challenge the methodology, what is the difference?
Yeah. Well, physical therapy, we talked a little bit before we got on, right? It's a very, very broad term, and it's like any field, right? You can go to 5 different accountants, and then some are just naturally going to look at things differently. Some are going to be more creative. Some are not going to be as good as others. Like the same thing is true with physical therapy. So it's very, very broad in that sense. And there's a lot of variables that are going to go into it. Some physical therapists, I'm not sure how they make their clinical decisions, but they don't have much of an assessment process, if one at all. Some of that is a time constraint, like just based on the settings that they work in. That's very true. For us, the biggest thing is understanding how movement occurs in the body, because once you understand how it occurs, you can then understand when it's not occurring, right? So you can fill that gap, and that goes a very, very, very long way. There are a lot of factors that can contribute, I will say, to whether a person experiences pain or doesn't experience pain. So that's also something that has to be considered, because the movement piece, while it's the medium that we work with, right? We are movement professionals. Understand that there are other things that can contribute to pain, right? So understanding, dietary habits, the behavior of the person's symptoms, like all that kind of stuff also has to kind of be factored in.
I think I became a quote hacker. Like, oh, I'm going to try this to fix this. And I think that got me in some trouble, where I was investing fully in something because I believed it would solve a problem. And there was no way to tell whether it was working or it wasn't working. I remember in the training I took with you, I'd never heard someone say that personal trainers are something like the most underrated healthcare professionals that exist.
Mm-hmm.
It surprised me, and the way it didn't surprise me is I know we have this huge gap between people feeling good and what's actually happening. Even lower back surgery in many cases doesn't have better proven results than people walking.
Personal trainers, right? They have access to work with the ability to work with a person for a very long time. I'm very good friends with a lot of personal trainers, and some of them have clients for 15 plus years. Like that's a lot of time you spend with a person and have the ability to help them, right, influence behavior change and all of the things that kind of go with like a quote unquote healthy lifestyle, however a person defines that. And with fitness tends to be one of those like anchoring activities where when a person starts focusing on their fitness, everything else tends to fall in line, right? Their sleep falls in line, their diet, nutrition falls in line. So they start to make like those, again, I'm using the word healthy like very loosely here, but they tend to have like a lot of healthy habits that go along with that. And that is the personal trainer's bread and butter right there. Like that's how you change someone's life. I'm a physical therapist. People come to me when they're in pain, right? So it's just a very different situation in that sense. But the from a movement standpoint, it's all the same. Movement's movement, right? So,
And what I'm hearing is an echo of the transition you talked about earlier is, well, you had a first problem, you went to a physical therapist, and then you had the certain set of results, and later you had a bigger problem and you had a breakthrough. But what really kept you going was, well, your recovery had to have a certain amount of momentum and support to keep deeply changing foundational patterns. And what you're saying is, and as the insurance system and the physical therapy practices have a time factor, and whatever financial metrics around getting someone out of crisis, but they cannot by design look at the lifespan of a person's movement lifestyle. Wow.
yes.
What would you say? And yet you're training personal trainers. So there's something that they used to do that you're adding to or changing. What would you say is the biggest change that occurs in a personal trainer in their approach once they work with you that's different than other personal trainers?
Yeah, that's a great question. But before I answer, can I just clarify one thing? I don't want to. The way that we work with physical therapists and trainers and movement professionals is we don't teach how to like treat pain. We teach you how the movement system works and a way to look at how the movement system works. So that is nothing to do with. I don't want people thinking like, oh my god, this guy's teaching unlicensed medical professionals how to.
Oh,
Yeah.
yeah.
I don't want to be taken the wrong way. It's all movement related, right? Like movement is movement. So to answer your question, I think the biggest thing is understanding, is simplifying how to view the actions that the body can go through and what they look like on a person. So when you're looking at how a person moves, you can identify the same patterns in anything, whether it's like a squat, whether it is a push up or whatever the exercise might be. You can identify the same patterns, and then just from pattern recognition, you can understand, okay, maybe this variation of the exercise isn't really optimal for this person right now, so we can make the change. I would say that's the biggest thing. And again, that comes down to understanding the principles of movement and how our body works and how our body moves, because then you can apply those principles to your practice as a fitness professional.
And maybe what I really meant to get at is, how are these movement principles different than the movement principles people have been training in fitness for a long time?
Yeah, so a lot of the common thinking is that there are patterns, right? So people have to do like a hinge, a squat, a push, a pull, vertical, horizontal, all this kind of stuff. And a lot of times, people where you get into trouble with that is that you try to make a person fit a specific exercise versus make the exercise variation fit the person, if that makes sense. So it's not like there's like a best squat variation. There's a best squat variation for you. There's a best squat variation for me and my goals. I would say that, yeah, that's definitely the biggest thing.
So customizing it. And what I learned from you was to look at the main movement is breath. That
100%. Yeah.
Yeah.
Well, so when you get down to that level, right? Like the breath, right? Your body's going to do what? It's going to breathe in and it gets bigger. So it expands. You breathe out, it compresses. That's all movement, right? When you put your foot on the ground, you're going from an expanded state to a more compressed state, right? So it simplifies things from that perspective, because then when you can identify quickly when that's not happening and then make the adjustments.
And another thing that has happened to me along the way was realizing which movements I was training that were interfering with my ability to execute a diaphragmatic breath, like doing a lot of backbendy, archy things, thinking that, I'm more flexible, and then, or even doing kind of collapsy, side bendy things. And I've learned over time to curate down what I think is healthy movement for me from when I was just following a group. Tell me about your own movement lifestyle. How do you pick what to train?
Yeah, so there always has to be like a goal attached to what we're doing, like that gives us the context that we need. So for me, like I said earlier, like running is the sport. Distance running is the sport that I gravitate towards, and I run a few half marathons a year. So I run right now, like I'm training for a race. So I'm running 6 days a week, and then I'm in the gym 2 to 3 days a week from a strength training standpoint. And I look at strength training as the thing that makes sure my body can withstand the demands of running, right? So it makes sure like my bones are strong enough, my muscles are strong enough, my ligaments, tendons, all that kind of stuff can support, the sport. And then everything else, like I said, kind of falls in line with that.
Right. And as a hypermobile person who was always attracted to things that are easy for a hypermobile person to do, like stretch and dance. And I realize now the missing piece was the strength training, especially as I got older. Once I hit 50 and my ligaments started to express all the habits I'd built up. Do you see common patterns for that where people aren't optimizing their results?
Yeah, this is a shift I've had over the years, and this might be helpful for people listening. The biggest thing for me is always optimizing for recovery. So meaning like, what am I actually able to recover from? So I think a lot of times when we think about the gym and strength training, it's always like adding more weight, adding more resistance. If you're not adding 5 pounds every week, like you're not progressing, all that kind of stuff. But in reality, right, that might not make sense. For some people it might, but not for most of us, right? So that would be one of the bigger things that I kind of consider now. And the way that I measure that is like, am I having trouble falling asleep, right? Or am I getting sick more frequently? Because it's a big shock to your immune system. Your body has to recover from training. It's a good stress, but it is a stressor because your body has to dedicate resources to actually allowing you to adapt. So, that's how you get the favorable changes from different types of exercise. I would also say like varying what you do. A lot of people, it doesn't have to be complicated. Like a lot of people benefit from like cardio, like riding a bike for a long period of time at an easy pace. Then you do a little bit at a moderate pace where you can have a conversation, but you have to catch your breath. And then at a very high intensity, like doing things across a spectrum is very, very useful. And then from the gym standpoint, it's very similar. It's making sure you're working some stuff that's like really challenging, some stuff that's kind of a little bit on the more moderate side of things. It gives your body like a good balance of things, and then exposing yourself to different planes of movement, I'll say.
Right. And this ties back to what you said. You saw the patterns of people either doing too much too soon or too little for too long.
You can't always push. We need times where yes, you have to push because that's how your body's going to get stronger and more fit. But then you need a period of like in our world, they call it like a deload, a period where you back down for a little bit, maybe like a week or a few days, maybe 2 weeks, depending on the person. And then the body has a chance to kind of catch up, have a favorable change or favorable adaptation. And then you can push. And that process over time, right, is always going to be the way that you win. It's the consistency that's always going to win. No matter what, it's always the consistency.
And I would like to go back to the long haul, because part of the reason I call my show The Architecture of Health with the Fibonacci Golden Mean is this to tie the idea of the longevity of classical patterns of natural forces and really getting a multi-generational view of what makes humans feel good. And how does it make us last in practical, sustainable ways? How do we know that we're selecting movements, therapies, activities that are aimed at our performance in the long haul? And one thing that changed in the last couple of years for me is I've just decided if it makes me breathe worse or it interferes with my gait cycle, my walking, and my ability to build up my running, I've just decided those aren't long haul choices for me unless they're fun. In fact, I saw something recently about people when they're listening to music they love, they got way more aligned just with the enjoyment of what they're doing. So does any of that spark how someone can envision like what's really lasting and how do I know I'm improving my capabilities and ease in the long run?
Yeah, that's great. I mean, you kind of said it, I think, as you said, like, I'll paraphrase, but like you need to enjoy it, right? A movement practice that you enjoy. And you just said you identify things that are meaningful for you and that you care about, right? There are things we know from like a medical standpoint, right, that have to do with longevity. Like we know that having like muscle mass. Don't think like bodybuilder, like, super jacked, huge dude muscle mass, but having lean muscle tissue on your body is protective from a health standpoint. So some form of, strength training a couple of days a week is probably useful. We know like VO2 max, so your aerobic fitness is also an important marker for longevity. But you can get all these things and build all these qualities in different ways. So for me, it's always finding what is something that the person enjoys, that it's not going to feel like a chore, right? Like a burden, because ultimately, if it feels that way, you're probably not going to do it for too long. And like we already said, consistency is always going to be the biggest thing. And this is also where hiring a professional, right? Like yourself, for example, right? Or someone in the realm that you're trying to get into is useful, because if you think about going to the gym, right? Someone who's never been to the gym before, that's like an intimidating situation. Like I take it for granted because I've been going to the gym since high school when I played sports, but there are people who walk in and they don't know what to do. So that's where hiring like a good personal trainer goes a long way, because even if it's just for a few sessions to teach you, useful movements or how the machines work or how to put an exercise program together, it's very useful from that perspective, because then you can start this habit and make it part of your kind of routine.
And I have to say, having a gym membership, it's so cheap and it's so fun. There's an empty room to dance around in. There's a sauna. How much time do you spend on when you're doing your strength training? And you've got high goals. Yeah,
I was
got
gonna say, like,
goals.
don't compare me to it. Like, it'll make people feel overwhelmed. So right now, what I do is, well, maybe not from a strength training standpoint. Right now, my running is it's between 5 and 5.5 hours a week. So
That's not much.
Training for a race. No, well, the strength side then is I do 2 to 3 sessions a week that are really focused on hypertrophy, so building muscle and maintaining, certain joint ranges of motion that I'm going to lose from the volume of running. They're 45 minutes to 75 minutes, I would say, per session. So it's a lot of time to spend training, but I set it's important to me and my goals, for a person who is like, I just want to feel strong and healthy, which is a lot of the people we work with. If you can get into the gym 3 days a week for 60 minutes, it's going to have exponential carryover to a lot of things.
I'm doing an experiment where every day I go to the gym for 5 minutes. I just show up, but I live right by my gym.
You're building a habit at the very least, right?
And then I'm always there an hour. I just have so much fun. So, and I need to do this to keep, what you're saying is, if you have a athletic goal, and mine is to dance exuberantly well into, until my dying day, and to be able to do the leaps. In African dance, we have to manage a lot of physical forces to do it well, especially the buoyancy. Kind of, that reminds me of running. That's one thing that attracts me to it, is you need the springiness in your body.
Yeah, well, we call it like the minimum effective dose. Like, how much do you need to maintain? How much do you need to support the things that you're trying to do from a physical standpoint? So it's, for a lot of people, it's not much. It's not. Like, if you could get into the gym and do one hard set of like leg press, that goes a very long way, right? But you said something else that I think is interesting, is that you go to the gym, I'm just going to go for 5 minutes, and then you end up staying there for an hour, right? It's like it's a very common scenario for people, is that they're like, oh, my body's so tired, I don't feel like going to the gym, like blah, 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 blah. And then they go and they're like, I did my first set and then I felt great. And then I just kept going, right? Like that's a very realistic scenario for a person, we're talking a lot about the gym as it relates to health. And this is going to sound probably counterintuitive when I say it, but I think in a lot of ways, we almost overvalue the gym a little bit and forget about, in favor of a lot of other things that we could be doing, right? So you take a person who, maybe they work in an office for, all day, and they don't get a lot of general movement. Like, general movement could be the starting point for you. Like, literally, like,
Absolutely.
let's get your step count from 2,000 to 6,000 and see how that feels, because that goes a long way for a lot of people. It's just finding something to start, attach a strong why to it, and then it like is the catalyst for other habits that go along with it.
And at the end of the day, general movement, that's what we are. We are general. In terms of cost benefit, because that's one of the other thing that's special about you, is going from finance to medical therapeutic realm. Let's just say this scenario. there's been an injury, a setback, and or some kind of pain. And in terms of return on investment, where are the great investments to get back on track and do the things you love?
Meaning, like, if pain is taking a person away from African dance.
Oh, yeah. I was crawling to the
Yeah.
bathroom a couple weeks ago, but I
Yeah.
got back on track because I had great support.
Yeah, that's exactly it. So in that situation, it's very useful to have a trusted, I'm going to say, physical therapist or somebody who can understand the medical side of things to help guide your process and give you that support and give you a plan to, progressively get you back to where you're going. Someone who's going to work with you, but also your other coaches, your other trainers, the other people who are involved in the process is very useful. We see it a lot with people who come and they find us at our physical therapy practice, is that they don't have that. No one ever gave them that guidance. They didn't know that they were supposed to be, that the exercises they were doing, right, or were given, they didn't know if they were helping or not. They couldn't tell because they didn't have a good understanding of the situation. And that falls on the practitioner to set that scenario up for them and give them the appropriate expectations.
So it sounds like good support, invest in good support. And I heard you earlier say also something, whether it's a physical therapist, personal trainer, coaches, the idea of support that it's not a quick fix. There's an idea of your whole ecosystem and planning for that. And yet there's an edge there where, for example, I don't go to any chiropractor that says I have to go every week, because that says to me it's not working. And same with stretching. I was stretching every day thinking that's just that it's working when it wasn't. The fact that I could stretch and then the next day I have to stretch again. And so the discernment of when we're building a dependency versus a relationship where there are the touchstones, because I think there are both sides where you're either not getting any help at all and have no larger perspective on how things could be, or dependence on just kind of an automatic setting. Like, I always do this. Like, I'm just going to go to my chiropractor every single week, no matter what. So how does someone build discernment to get the support without it being a crutch? And I'm answering my own question in terms of you have the ability to help people measure whether something's working or not. And those are even some of the tools I learned from you. I have for my own practice. Like, I check, did my hip range of motion get worse or better? Is my diaphragmatic breathing getting worse or better? So anything you want to say about that?
Yeah, I mean, I think you kind of answer your question, your own question, or at least the answer I would typically give. But there should be some type of plan, right? That is going to be like, okay, here's where you're currently at, Deb. Here's where you're trying to go. Here's how we're going to get you there, and these are the things that are going to tell us that we're on the right track along the way. And recovering from any kind of pain or injury. First, I'll say this: pain and injury are kind of like, they're like a part of life. Like, they're going to happen. It's not we're going to avoid these things. It's like really when is it going to happen? It's going to happen to all of us at some point. So understanding that is normal part of the process, but having a way to overcome that and get back to doing the things you want to do, so is where you're going to need this process in place.
Cool. I can't think of anything else to talk about is there anything you want to add before I tell listeners how to find you?
No, well, I guess the one thing I'll say, and maybe this is just as I just recently turned 40, so this is on my mind a lot. But a lot of our patients say the same thing, and it's just very interesting, is that, they'll use words like, I want to feel, like, we ask, why are you reaching out for help now with your shoulder pain or whatever it might be? And a lot of people say the similar things, like, I want to feel strong again. I want to feel healthy again. I'm afraid that if I don't address this now, like, what's it going to be like in 5 years, in 10 years? And all of that, like, is something that we can all relate to, I think. And it comes down to is what we've talked about, I think, for the past 45-ish minutes or so. It's really, when you look at your health and all the things that go into making you feel healthy, like it's an investment in yourself ultimately is what it is, right? And we have to take the steps now, like when I'm 40, right? And obviously prior to that, because that's ultimately going to set the stage for when I'm 50, 60, 70, hopefully 80, 90, 100, however old, if I'm still doing doing good at that point. But we set the stage now. And it's always one of those things. It's like, when was the best time to start? It was probably yesterday, but the second best time is now. So finding people that can help you is always going to go a very, very long way.
Okay, I've got to throw in one personal question that I have is, how long does it take to recover from ligament damage from overstretching?
It's injury related, or like what maybe define damage? Yeah.
Joint instability, just constantly having to strengthen back up because of joint instability, and then being more prone to injury because of, or am I just overthinking this? Because my understanding is and I may be wrong, that when you overstretch ligaments, that they don't just instantly recover, and that the communication, your proprioceptive system can get a little mixed up. Just, is there anything you want to say about overstretching?
Yeah, well, in general, right? We'll take the stretching out of it for a second. Like, we're all gonna have a natural predisposition just based on our structure, right? Some people are stiffer, some people are more flexible, right? So it's understanding that, is, we call it in our world, like, that's just a constraint that we have to work within. This is the person, right? So how do we support whatever their end goal might be? So typically when you have a situation like where you're describing, where someone might be on the stretchier side of things, there are things that I would focus their exercise routine on. That's going to be like plyometric type stuff. So things that are quick, where you're like getting on the ground quickly. It's probably why you like running, because if you're doing it at certain speeds, your body, the tissue, like the ligaments that are stretched, are going to get that, like think of like a rubber band. They're going to get more of the elastic quality, so they'll be a little like snappier, if you will. And then strength training, right? So strength training, your muscles can act as support for your ligaments, right? Meaning, like, if you have like like laxity in
joint
a ligament, joint laxity, yeah, the muscles also cross over that. So when you like think of like a bicep, I don't know if I'm on camera, like this is on camera or not, but when you flex your bicep, the muscle is going to pull on the tendon, which is going to pull on the joint capsule and the ligaments and all that kind of stuff. So they all act in synchrony. So you can address it from that perspective as well.
And I'm getting, again, this theme. Not everybody's the same. And whatever your tendency is, when you're going too far in one direction, you mediate that with the counters and the amenities that you don't have. And I would have the very different set of things that would improve me if I were very tight and not stretchy at all. And so I've heard of even a yoga teacher sitting in lotus for hours, and then her femur bone descending through her gluteal muscle, and so that's one reason I call myself Yoga Survivor. Is, as a child, I used to sit in lotus pose for hours and hours reading, and then when in PE after summer was over and they made me run a mile, I couldn't even walk the mile. I had to sit and stop, and so I was shocked that kind of a postural decision had cost me so many other movement options. And I guess that's why I'm bringing this up, is I can't share with the audience how important it has been, what I've learned from Shaun in terms of having tools to measure, and the support, the people that I've worked with, like Encore and Shaun and other people in this realm, that are helping me really not just lean into my existing tendencies so far I break, that I have these perspectives from both outside and measurable qualities that ensure that we're going to be dancing and running until we're 150, Shaun.
That's it.
So yeah, you got to come to an African dance class with me, okay?
One day. That'll be a show. That'll be a show right there. Yeah.
And I by the time I'm 60, I'm 56. I hope to distance run by the time I'm 60. So maybe I'll see you there. All right.
That's awesome.
So for people to find you, I'll be putting links to your various programs and accounts in the show notes. And thank you very much, Shaun.
Thanks, Deb.
Bye.
See
Bye.